Hello, everyone. I would like to thank you all for coming here, both those who are here in person and those who are joining us virtually, especially our colleagues in India, who is now, at the moment, it's their late evening. So thank you so much. And we're so excited about having you all here and for a very fruitful meeting and discussions today. So in the beginning, I would like to acknowledge the land on which UHN operates. As a mother, as an immigrant, a person of color, a care provider to my parents, and a researcher. UHN is located in Toronto, currently known as Toronto, which in Mohawk means where there are trees standing in the water. And it was used to be a location for treaties and for the indigenous people to get together to meet and then have treaties. Today, Toronto is covered under Treaty 13 and the William Treaties. It is the traditional territories of many First Nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. These indigenous nations continue to experience ongoing exclusion, colonization, and displacement in Canada and everywhere. As a settler, I have been and I continue to benefit from this land. I would like to reflect on my responsibilities towards the land and indigenous peoples who were and are its stewards. As a mother of a young daughter, I'm heartbroken by the harms of residential schools and their impacts on indigenous peoples in the past and as it continues to affect indigenous communities in the future. I'm thankful to the land and its resources, and I teach my daughter to respect Earth, its resources, and others who live and rely on the Earth, and to just take as much as we need and make sure we leave resources for the others. And as a researcher, I acknowledge the harms that we have done and continue to do to indigenous communities by not appropriately engaging them in the research, by not reflecting on the needs of the community, and not building a respectful and reciprocal relationship with indigenous communities and peoples. And the list continues and applies to many other underserved and racialized communities. I would like to join me in taking a moment to reflect on the land that you are on and the work we have to do to make the promise and challenge of truth and reconciliation real. Thank you. And now I would like to invite Dr. Miloš Popović, Director of the Kite Research Institute and Biomedical Engineering Department at University of Toronto, to join me.
Thank you, Azadeh. So I am delighted to welcome you all to inaugural Fibre Colloquium. This is a partnership and project which came along as a joint venture of Sona Group, Sona College of Technology, V Technologies, and the Kite Research Institute. We've been doing this since 2021, 4 years now. And the main objective of this enterprise is to try to develop fabric-based wearable technologies which are predominantly focused on healthcare needs and healthcare applications. And of course, we're looking to solve the problems which are global. And because the main partners are Canadian and Indian partners, we're looking to have our first commercial solutions in those spaces like India and Canada. Presently, we have about 15 joint projects. And there's another 8, I think, Krish, that are in pipeline. And so we're very excited about that. And today you have an opportunity to meet various engineers, clinicians, entrepreneurs, and partners on the project. And they'll share various expertise in medical side of the house and technology side of the house and material science and whatnot, pertinent to those wearable technologies. Excellent opportunity for you to meet people who are in fields which are complementary to yours, try to get some partners and collaborators, and I hope you're going to enjoy this day today. So the next thing which I would like to do is I would like to introduce to you Choco Valiapa. He's our esteemed partner. Fiber project would not be here if it was not for Choco and the major investment that Sona Group and V Technologies put into this project, which is about $8 million. And the whole thing started in various conversations through one of our mentors and donors, Lucky Lakshmanan, Dr. Lucky Lakshmanan. And then Lucky introduced me to Choco. We met Choco at Rehab Week 2019 in a coffee shop. And then the next meeting was in Germany, in Berlin. And he ran me through a test. We were in an Indian restaurant, and I had, or Thai restaurant, actually, the Thai restaurant. And I think he ordered the hottest dish that exists in a German-speaking part of the universe. I survived that, and that's how all this came about. Joking aside, Choco is a fourth-generation entrepreneur. He founded V Technologies, which is running the diverse type of programs and projects. It's created in 2000. And a lot of that is in artificial intelligence, in managing accounting and various businesses in healthcare industry. They're also running Sona Group or Sona educational arm of the business, which graduates about 12,000 students every year. So this is a large educational enterprise as well. He's an expert in business operations, strategic planning, education, technology. I think he has a degree in textile and textile manufacturing. He's a visionary and very exciting person to be with and talk to. And I'm delighted to have Choco and Christian whole V Technologies, the Sona Group, as a partner to Kite. And without this partnership, we would not be here today. So I would like to introduce Choco, and I think he's going to join us virtually.
Can you all hear me? Yeah. Yeah. I can hear Krish. Good morning, everyone. Good evening for those people who are living this side of the hemisphere. Thanks a lot for that, Milos. It's a pleasure to be here today to speak about an evolution of 100 years of what transpired with us as a group at Sona Group. So we started in the 1920s, and our origins of the group is actually dating back to textiles. So the roots of us has been in textiles. So this is where I'll speak about that in a bit. And this slide that you see in front of you actually symbolizes what we do. It's the banyan tree. And the banyan tree, we chose the banyan tree as our emblem to represent us because there are many trees in the world. A coconut tree grows very tall and it provides no shade. But a banyan tree, as it grows, it keeps spreading and it provides shade. And as it grows, it also puts roots wherever it grows. So that's how today you're all in Canada. We have V Technologies Canada. The slides are there? Yeah. I think you're sharing it, is it? Okay. Yeah. So the Sona Group, as you see, has branches across the world. And then one such branch is V Technologies Canada, which is a branch of the banyan tree. So we believe in being as local and as global as one can truly be. So that's how we have our operations spreading across 7 countries in the world, starting from Australia to Canada to the US, Philippines, India, the Middle East, like that, and Singapore. So this building that you see also epitomizes what Sona Group does. So this was built in the 1980s, and in 1982, and 1982 it was far ahead of its time at that time, and this was the one which actually was the, like, we all speak about the green revolution in India, which happened in the 70s, and in the 80s a technology revolution happened. India was wanting to become into the superhighway of information technology. So this is the building where IT was started in 1982, when Texas Instruments came forward and set up uh, with a satellite dish on the top. And this is also the building where the telecom revolution happened, where CDOT actually seeded. CDOT is a center for data and telematics, which was set up by Sam Pitroda and the under direct direction of the then Prime Minister, and to take telecom forward. This is also the building which revolutionized the consumer movement within India, where a brand new watch, which became the symbol of the new India at that time, called Titan watches, which started. So that represents the Sona Group, where we are headquartered today, actually. So the four generations, as we spoke about, let's talk about the history here. So our founder was a journalist and then went on to become a textile entrepreneur. And then he wanted to build, and he was also a freedom fighter when he was friends with Gandhi. And we were all talking about textiles here. The freedom movement had a part of textiles as a key thing for India. When Gandhi said that we should stop embracing foreign-made goods, and he spun his own clothes. The Khadi movement started by Gandhi, and one of the things he found, a lot of Indians were not able to afford a shirt, because those days the rainfall was very low. In 1921, when he made the journey across to our founder's house, it was in our founder Kalaitande Karmuk Tyagara Chettiar's house, that he was a guest. And he came out in the morning with only one piece of garment, and he removed his shirt and he never wore it again. That was a moment in history which we celebrate September 21st in India, as a moment where he realized that. But ironically, the same year, our founder was actually setting up an IPO for a textile mill. And his lifetime ambition was to be the biggest textile operator, which he did achieve in 1971, where he became the world's biggest spinner with about 500,000 spindles, and spanning 14 textile mills. And that's how our educational movement started. And the Sona Group, the Tyagaraja Polytechnic group, that started as a part of that movement, in order to develop a breed of people who can be aligned to his textile industry and his various industries. So our founder, Mr. Chokulingam, my grandfather, continued that and established Sona College of Technology, building on Tyagaraja Polytechnic success. And our current chairman, Mr. Valyappa, has continued that and started Sona College of Arts and Science and various other institutions. And I'm trying to follow in their footsteps in a small way. So if you go down and you can see the different things that we do, I'm talking about the spread of things so that some of it might come into your limelight as to what we can do and how we could do. And, from the areas of possibility, opening up different realms of conversation in that way. So we started in textiles, and then we got into education. And in education, we have several educational institutions. And then we also got into plantations in the 1970s, growing crops like coffee, pepper, cardamom, and stuff like that. But what may be more relevant here is we have a very, very, very deep strength in mycelium. And mycelium is mushrooms and stuff like that. And now mycelium is being used in different contexts in different parts of the world, totally differently. So, for example, in Japan, if they have to get a metro station, the metro station pathway for the train is determined by the growth of mycelium. They grow the mycelium in one area and they give food in the other area where the train is needed, and then it draws the path across to the closest way ahead. So in mycelium, so today we have one of the best mushroom centers technologically in the world where we grow. So any types of mushrooms, myceliums, extraction, we're trying to develop, like for example, gold particle, synthesize gold particles through mushrooms, for example, things like that. So this could give a new pathway. I'm not suggesting a direct pathway, but it could open up some of your antennas to think about potential collaborations. And then again in education, when it comes to education, there are several educational institutions in India, but traditionally more than 2/3 of the research, I'd say that 90% of the funding for research in India has been given to public institutions. So very few private institutions come out as research organizations. So, but SONA and SONA institutions, including Tyagaraja Polytechnic, SONA College of Arts and Science, have been an outlier in that perspective, where we said that we should recruit the required faculty, and that's how, as a result, we have 300 PhDs today. And so the 300 PhDs have combined together to get a lot of workforce and the research power that we can bring together. And that's resulted in various research opportunities. And and there are several ways of how our network is cross collaborating. So, for example, if you take Valepa Foundation, for example, we do on the ground research. So we are working with a lot of universities in the UK in terms of trying to take. They're doing a lot of research it's a project called Tigress Project, Technology Intervention Post Green Revolution. So that is a research work which is done by the UK people, and but the low on the ground implementation of that survey, for example, is being collaborated with Valepa Foundation, which is doing, is it going through the last mile, so things like that. So, and then you see Sona Speed here is a manufacturing unit of ours, where we are working with the likes, I think we're working specifically with Milos in terms of trying to see how can we start manufacturing some of the inventions, the IP that has been developed, and then actually develop that into products that is being done across. The other one you see is the mycelium logo, which is what we spoke about. And we Health Tech is a company which is collaborating with, it's actually working with close to 400 hospitals in the US. So if you take the USA, today is the top 20 hospitals. So we literally work with, I think, 16 or 18 of them. So if you take Boston, all the Boston hospitals, Mass General, Brigham and Women's, or you take Hopkins, or you take University of Chicago, Duke, Cleveland Clinic. So the list goes on, so we have a plethora of universities that we do work with on primary areas of clinical documentation, improvement, clinical risk audits, and revenue cycle management being the core areas. But now we're getting into patient engagement and a lot of other allied areas as well. And We Technologies, again, focuses on niche engineering areas. So be it fire, if you take a fire engine in America, 1/3 of the fire trucks are designed by us. And so things like that. So we have certain niches, oil and gas. And so the idea of We Technologies is to take the firepower of the talent that is produced in SONA institutions and other institutions around, and to take them and package them to the industry at large. So we have a total ecosystem of industry with a strong academia and a proven experience across. So that's how when I met with Lucky through Krish. Krish represents us in Canada. And one of my first meetings when we had, he said, "No, let's drive over to meet Lucky." And we met Lucky. I was lucky to meet Lucky. And I'm sure, as everyone here would agree, one of the great visionaries. I was privileged to meet him. And then Lucky took me to UHN and then met with Milos and the team. And again, it was a good, unique conversation with Milos in Germany, in Berlin, on a Sunday, actually. It was, I'm sure you've all seen Milos in the outfit, but it was unique to me to see a guy wearing shorts, a shirt, and a bow tie on a Sunday in Berlin. So we enjoyed the conversations as always, and then that's how we stitched together this partnership which we are all lucky today to be a part of, this 15 projects, like what Milo said, and then the round 3, which is coming across. So we thank our partners, the academic partners and industry partners who have helped us put this together, because we do see, in a way, the wearable technologies is the convergence of the Sona groups through 100 years of coming in from one side, from the textile side, other side, the convergence from the new technology side and things like that. So because we think that this is the new area of healthcare. Because one of the things that we've learned across in V Technologies is that because we work a lot in the Medicare Advantage scheme in the US, and we almost cover 35% of the Medicare Advantage population, is that we've seen the evolution of how healthcare has transformed across the landscape in the last 25 years, but more acutely in the last 10 years, where we started working on the Medicare Advantage scheme, where we started 10 years ago in retrospective risk, so that patients, we would go across and recruit and then do an analysis of the health retrospectively. Then it came concurrently, but today we are looking at proactive risk. So what are the risks and what could be the ramifications of the risk as time goes by? So there may be 2 patients, both male, 50 years old. One may have hypertension, one may have blood pressure. What are the chances of a person having blood pressure, developing glaucoma or something like that? Or what's the chances of a person having diabetic having diabetic retinopathy or something like that? So depending on the risk scores, so maybe they have headache, fever, whatever the triggers are, then we ask for an eye dilation test. So all of this requires data, and what I think everyone here today in the table is focused on how can we bring that together and then get it a step ahead, so that we can be step ahead of healthcare, and then in terms of trying to mitigate those, so, and that's been the goal of our the Fibre project. And so you can see some of the areas that we've been working on, so, and there are different dimensions of how this can come across, especially if you put and collaborate mindsets from Canada and from India as well. So the clearest picture of how we have seen this is some of the achievements that as a great outcome for Fibre, for example, is when we had the hackathon, right? So wearable technology hackathon, which happened, I think maybe a year ago, a year and a half ago, was that the 3 teams which won, all the 3 teams, first, second, and third, had students not only from Canada, but from India as well. So that shows a clear indication or a vindication that what we are doing is coming and bearing fruit in the right sense, because it's a true diverse thinking, and we bring different skill sets across, working either maybe some ideas come there, but some implementation of how we can execute that idea application of that idea, actual pilot spinning, so one of the things could be like you can have conductive fabrics, but how do we induce conductive fabrics is something that the team here has access to, whether it could be woven, it could be knitted, or whether we can use spun yarn, we can use fused yarn, whether we can use a coating, or some of those are things which not that people in Canada might not have the skills or something like that, but maybe they don't have the time or the materials or something like that to go to a loom or something and then devise certain areas and then modify certain looms or something, or knitting machines or some of those things in order to implement those things. So that's how this actually stems across. And I often recognize Bill Clinton as a great speaker, right? So, and one of the things that Bill Clinton very often used to say, you put India and North America together, you get the true 24-hour democracy. And that's what we are both doing together. So we are getting in 24 hours, not of democracy, but of 24 hours of engineering, innovation, and all of it. So if you look at the list of projects, for example, the 15 projects that we've done, and so that is again a testimonial of the diversity in this, where it from socks to ear hearing or something, or not just when you're awake, but when you're asleep too. So it adds that dimension across. So and I think we're covering some of the topics later, so perhaps I'll have Krish summarize some of this thing in the next couple of minutes. But let me just talk about two points here. So we put these 300 PhDs together, and then we have a unique a blend of diverse researchers. And the greatest example of our success has been the motors that we have put together, the stepper motors, and the BLDC drives. So be it for satellites, be it for rockets, be it for gyroscopes. So we have designed, developed, manufactured rocket motors for the Indian space program for the last 8 years, including the final landing on the moon, and where the last stage, the cryogenic engine had to have a fuel mixer to mix the hydrogen and the oxygen together. The fuel control mixer ratio is done by us to enable the final moon landing. And now we are working on a similar thing for the Mars mission as well. And we've also done stepper motors, which is basically for the first stage propulsion for the rockets to take it to from the ground up. And we've also done India's going on a shuttle machine, which basically tries to get into reusable spacecrafts. So you can see the helicopter there, which is being lifted off into, I think, about 5 kilometers height, and then the rocket takes over. And that mechanism is actually engineered at Sona. So I'm just trying to give you just the criticalness and the depth of research that we can bring into the table as and when needed. And if you look at some of the other stuff that you've done, the thinnest watch in the world is again by Titan watches. It's called the Titan Edge. And that is, if you go ask the value for money watch, it's a Titan Edge watch. And the bottom of that watch has been enabled at Sona and engineered at Sona, where we developed a nano coating and a nanotechnology at the bottom. So I wouldn't go through too much at the bottom. And then you see the hackathon winners, which I was talking about. The 3 prizes was won by Sona and Tyagaraja Polytechnic students, along with the Canadian students in Canada. So it's a unique combined thing. And finally, just talking about some of the research ecosystem that we've had, we've now partnered with most of the Government of India's Department of Science and Technology, the research, industrial research team. Ministry of Textiles has given us a state-of-the-art laboratory. And welcome every one of you to come in and visit us. So we're literally perhaps just a flight away to India, and then and another flight to Salem. And we also would like to extend this research in fiber to just not projects, but perhaps papers and potential joint collaborations across with different areas. So I'll end here, but Krish, if you want to add or if you can add something, so please do add or talk about a couple of projects if you do have something, Krish. So.
Thank you, Choco. We in fact will be we'll be presenting some of the projects as well. So rather than speak very specifically to some of the leading edge projects, Choco mentioned the one that we are now in prototype development for the functional electrical stimulation through sonar speed people like Arun Saligrama. Rather than speak about specific projects, maybe I'll use the key word that Choco mentioned before, which is collaboration. This whole set of 15 projects that we have done, they've all involved collaborative work with the Sonar College team, led by Prabhakar, Dr. Prabhakar and Dr. Raja primarily, plus many others. And the nature of this collaboration, I've seen it grow from the first project that we started in 2022 to today. It has moved from an area where it was like, how are we going to work with Sonar? What are they going to do? To now engaging with Sonar and taking their advice and their research and their results and so forth and blending it into the product. And I found that to be one of the most emphatic areas of the collaborative effort of fiber. The second thing that we have done is we always treat these as projects. And it's very important to do that. We got to have a budget, we got to have a timeline, we got to have manpower, we got to know where the funding is coming from. And we are managing all of those with people like MyTax. So we're trying to stay on top of the funding in order to make sure that the research continues, the development continues in this collaborative way. Now, as I said, we're going to be speaking about some of these very specific projects, but I like how, for example, on the safe sleep that Azadeh is leading, how the prototype development, the thought process, how do you deal with the pressure, for example, when you sleep, on which side of the body do you sleep? Do you sleep on your back, on the side? How do you design sensors that can actually work in all these different situations? Because you can't have a garment for side sleepers, another one for that, because people may change. But is that kind of thinking, that kind of result, that kind of experiment, and doing some tests that the Sonar people have done, which go into the thought process of developing the garments. That's what I find very exciting, and we are, on behalf of V Technologies, V Canada, we've been excited to collaborate. We speak every day, and people like Kirti are just terrific at making sure that the buses run on time, that the people are aware of what is going on, and people like Prabhakar Raja and the whole Sonar team, they're so much on top of the projects now that the results are now going to be the next step. And the step after that is commercialization of these products. So with that, I think, is there anything more, Choco, that you wanted to add?
Yeah, Krish. So thanks for that. So I would also like to thank the entire the UHN Fiber team, all the collaborators, but specifically with Milos, Asade, Dr. Sophia, Dr. Helen, and everybody else who's put this together from the Sonar team, V Technologies team, and everyone who is our partners in this. So we're excited about the future, and we're looking at brand promises, extraordinary outcomes. So this is what we all look, and the proof of the pudding is in commercializing this to actually get it to the people at large so that they can see the benefit, because that's the proof for all of us looking at. So thank you. Thanks for giving us this opportunity. Looking forward to meeting you in person soon as well. So thanks. Happy to address any questions as well, or suggestions or comments. Thank you.
Thank you very much for the great introduction, Choco and the team. And we are very grateful here at Kite and UHN and Fibre for this collaboration that we have had with Sona, V Technologies, and Krish over the last few years. So now I would like to take the opportunity and give you an overview of the activities that we are doing at Fibre that also overlaps with and covers some of the work that we are doing with our colleagues at Sona and some of the history of the Fibre. So as you all know, Fibre was established with the vision of Dr. Popovich in 2015. That's where it started, with the vision to deliver revolutionary textile-based wearables to provide care wherever users are. And it's important to remember, this started in 2015, and I'll come back to that. So what is Fibre, or what the goal is? So it's the world's first hospital-led initiative with the goal to develop medical-grade smart textiles that are designed for equitable access and inclusive adoption by end users across various industries. And that really talks to what Choco mentioned in his presentation. What we hope to do is to pioneer innovative textile-based wearables to provide care in any setting, not just in the hospital, but really where the people are in any location. And to do that, we have established an interdisciplinary team, including designers, engineers, people with lived experience, to co-develop, co-design, and co-implement these technologies, especially with industry partners. We are very fortunate to have a very strong partnership across Canada that covers academics, care providers, and industries across Canada, as well as international partners. Sona and India and V Technologies have been our strongest partner. We also have academic partnership in Europe. And what we want to do, I want to bring this study that just published in 2024. It was published in October 2024 as a joint effort of Ontario Hospital Association and then also the Dalla Lana School of Public Health at University of Toronto to look at what is the healthcare status in Ontario. And it can be applied to everywhere else too. So what they found as the final report is that healthcare in Ontario needs an innovation revolution. Without it, the system won't be able to cope. We already know that. Why do we have this challenge? Because the prevalence of the illnesses, especially people with major illness, is going to increase significantly by 2040. And more importantly, people are having multi-morbidity, multiple conditions at the same time, that is going to significantly drive the healthcare cost. And remember that even now, the system is not functional fully. The recommendations is to have prevention and early intervention, investment in digital health, pay attention to social determinant of health and equitable access to care, and then community-based care. And this was all the time the focus and the goal of Fibre from the beginning in 2015, where the vision was established. So it's good that everyone else is now looking into the importance of how we have to bring care to the people outside of the hospitals. So I'm just going to give a few examples of the chronic conditions that we're dealing with, the people across the lifespan are dealing with, and textiles or smart textile are having a very unique opportunity to take care of them. And these are a few examples. The list is much longer, but I just wanted to give an overview. So one of the Most important one is the hemodynamics, how the blood is going in different parts of the body. What happens when we take water or dehydrated or overhydrated? And I'm sure a lot of you have heard recently that now sitting is the new smoking, and then how important it is to really be active. So this is a video that I usually use, and that is showing that with the change in the lifestyle, what we're doing is spending a lot of time sitting or limited mobility. And because of the gravity during the day, a lot of fluid accumulates in the legs. Very much like if you're in a long flight and the legs are getting swollen. You all know, never ever take your shoes at the beginning of the flight. At the end, you can't put them on. And what happens is that when we lie down to sleep, now that fluid that accumulated in the legs can now move to the rest of the body because there is no gravity anymore. And the fluid, the extra fluid that gets to the upper body can make the airways narrow in the lung and then increase the risk of asthma. Or if it gets to the neck, it can make the airways narrow and increase the risk of sleep apnea. If you measure, for example, your neck circumference in the morning and in the evening, in the morning it increased by 1 centimeter. So being able to monitor hemodynamics, the blood volume, and then the amount of dehydration is very important in several chronic conditions like heart failure, renal failure, in people with venous insufficiency, as I mentioned, in sleep apnea. During pregnancy is one of the most important conditions that the people are dealing with, a lot of fluid retention that is necessary. And then also in people with chronic lung disease, like chronic obstructive pulmonary conditions. This is a large group of people that they're all dealing with extra fluid in the body. As an example, when it comes to the heart failure, we all know that it's a big challenge for the community and for the healthcare system in Canada and globally. Within Canada, 1 in every 2 people are dealing with heart failure. And the biggest challenge with heart failure is that a lot of the people who are diagnosed with heart failure have a life expectancy of 1 to 2 years. They stay in the hospital too long. And then more importantly, when they are discharged from the hospital, 1 in 5 person come back to the hospital with symptoms in 1 month. So it's really important to find ways that we can monitor them better at home and know if something is going to go wrong so that they don't have to come to the hospital. What is the current status of care? Is that when the people are diagnosed with heart failure, because fluid is a big thing, they say, okay, monitor your weight. And then if your weight is increasing by more than 2 pounds or 4 pounds or 6 pounds, even that number is not consistent, it means that you're building too much fluid in your body and in your lung, you're going to get hospitalized. But that's not a good measure. The weight can change a lot. And then it's just good to predict the hospitalization 2 days ahead of time. But we know that there are invasive methods, devices like the pacemakers that they can monitor the fluid in the body, in the lung, and then predict hospitalization 2 weeks ahead of that. So that 2 weeks give time to the physicians to change medication, maybe more diuretics or more adjustment to medication. But these devices are invasive. What we want to do is to have textile-based technologies to monitor fluid and prevent people from hospitalization. So that's an example. So we have done this. We have developed technologies that measure the impedance of the tissues, of the leg, of the chest, of the neck, and we showed how good it can detect the outcome and clinical outcome in a wide range of people. But the gel-based is not good. You can't just put gels and electrodes on people all day long. So that's what we started to see, how we can develop electrodes that are embedded in the textile, like think of a socks with electrodes in the socks that can monitor how much fluid you have or someone has if they're getting more edema in their legs. And we're very fortunate that this is one of the projects that we're going to continue working with SONA to expand. We also looked at, we all know that children don't like to come to the hospital. This is not the place to have children. And in another study, we showed that if we have with another partner that we can have electrodes embedded into the textile like a band to monitor cardiac function in children who have heart disease, and show that these electrodes embedded in a band are as good as gel-based gold standard to monitor cardiac activity in healthy children, in children with cardiac conditions during exercise, activity, sitting, and so on, trying to help better monitoring for children. This is another project that we're so fortunate to have and working with SONA, that how we can embed electrodes to monitor respiration, cardiac function into textile that can be used for monitoring sleep, especially in people who have a lot of challenges during sleep, like heart failure, like pregnancy, like chronic health conditions. And I always like to talk about the sleep. So because there's always someone in the room who is snoring, someone who didn't sleep the night before because of the problems, the bed partner is snoring, the kid kicking them out of the room because they're uncomfortable and they didn't have a good sleep, or because they just had a very bad night for stress and insomnia. So sleep is something that is quite important. Everyone is dealing with it one way or another, especially as we are aging, as we are having more conditions or the stress is increasing. And the current gold standard, if someone has a sleep apnea, is to send them to a sleep lab. We have very good sleep labs, very fancy ones upstairs. But what they do is they connect 20 different sensors to you. They tell you to sleep at this time, wake up at this time, and they're going to monitor you, and someone is watching you. And you can imagine how good it is, and how gold standard it will be to sleep in a sleep lab with 20 sensors attached to you. And for that reason, and how inconvenient, inaccessible, and expensive it is, more than 80% of those at risk of sleep apnea are not diagnosed. There are alternatives, like there are portable sleep apnea monitoring, there are watches. We here at Kite patented and have a device that monitors a sleep with a small patch over the neck that got FDA approval. There are rings. And the growth of all these wearable technologies to monitor sleep shows how big of a problem sleep is, and how the attention for the people is to find better sleep. But they're still expensive. They're still resource intensive. They still need someone to analyze the data, and they have limited accuracy when it comes to like high-risk population, like someone with heart disease. And that's not the only problem with the sleep. When it comes to the treatment, it becomes even more miserable. So the gold standard treatment is to have the mask to apply positive air pressure. And it hasn't changed really since 40 years ago, which it was established. And then many people cannot use it. It's not convenient. It's really heavy, and people don't like to have to sleep with the machine. There are other things like trying to move the tongue forward, trying to move the jaw forward to open up more space in the back, or having something like a shirt that with a ball at the back to make sure that people don't sleep on their back, because usually people have a sleep problem. I don't know who can sleep with that. I know Milosh told me he never can sleep with something like that because it's so uncomfortable, especially if he wants to read books at the beginning, and he wants to do that in his while he's back. So it's inconvenient. And one of the biggest problems is that none of these technologies were built with users in mind. They were like the companies doing that, and then it's always one size fits all. There are more advancements, like a stimulation of the main muscle in the tongue that is basically keeping the airway open. It would be something like a pacemaker for sleep apnea. It's invasive. It costs about $40,000, and it's not approved in Canada, but they do that in US. There are other devices to activate the tongue, like this one when someone is awake, or the muscles on the chin. And as I mentioned, it's progressing, but it's still too slow. And the challenge is that still we don't look into what the people want and what is the best solution for different population. And these are what we hope to work together with SONA. So we have a project with SONA in terms of how we can incorporate different sensors and actuators in a shirt that can monitor sleep apnea and hopefully provide better treatment for sleep apnea. And this is an example of the work that we are doing. We're also looking into, it's not just diagnosis that is important. It's important to be able to apply interventions like electrical stimulation to activate the muscles. So the figure on the right is an example of the project that Dr. Popovich have done with Sona, and they patented. These are electrodes that are dry, that you can put them in a sleeve, you can put them, and they can stimulate the muscles to activate the muscles, and it depends on which muscle you want to stimulate to change the condition or the parameters. We are also having a very strong partnership with colleagues like Humber College that are developing different textiles for us, like in collaboration with Sona. Again, these are examples of the textile sensors to monitor activity of the muscles, like the EMG. So instead of using gel electrodes, we can have these nice electrodes embedded in the textile with these different patterns to monitor muscle movement. And there can be a lot of applications for these ones. For example, with the stimulation, some of the projects that we are working is how we can improve the movement of the arm or other part, or the other extremities in people after spinal cord injury, and try to help them to get independence. The other project is that again is happening within the Fibre team with leadership of Dr. Popovich, is how we, and then also Dr. Zarifa, is how we can activate the muscles in the face to basically help the people to feel better, like as if they're smiling, and then by activating that, help against depression. One of the biggest problem for many people, at least for my parents, is falls. They don't go out if there's a risk of fall. They're always trying to think of what to do, because the fall, a lot of the injury-related falls lead to hospitalization, and it costs a lot. But even more importantly, 1/3 of those who are hospitalized with falls end up in long-term care, because if there is a broken bone or hip, then it's really impact their independence and their functionality. So detecting fall and then also preventing that is a big thing. And that's one of the other projects that we are doing, of how we can embed electrodes and sensors into this clothing. You can think of legging, you can think of shirts with sensors that can monitor movement, monitor kinematics of the body, and then also the activity of the muscles, and apply some sort of a stimulation, for example, through electrical stimulation to activate the muscles to help the people prevent fall. Another area that is very common in older adults, especially if the people are having diabetes, is foot ulcer. That happens due to peripheral vascular disease or neuropathy, and it affects about 850,000 people in Canada. The biggest challenge is if it's not treated, it leads to amputation. And that's one of the biggest fears of people with diabetes or people in rural areas, that with a foot ulcer, it's a foot, it's a toe, and then it becomes a foot, and then they lose a limb, and then they lose the leg, and they lose independence, and then that's basically a downward. So what the colleagues here are doing, and that is Dr. Naguib and Dr. Lee, and then in collaboration again with Sona, is how we can have smart socks that embed sensors and electrodes to detect extra pressure, detect if there is a extra or the change in temperature that is going to lead to formation of the foot ulcer, and then do a stimulation, different types of stimulation to prevent formation of foot ulcer, or if it happened, try to do healing and expedite the healing process. You can think of that for foot ulcer, but you can also think of other bed sores that can happen. And then it's a big concern, especially for people in hospital, in long-term care, and how we can develop technologies and smart sheets that can help prevent bed sore. So these were just a few examples. There are many more opportunities of what we can do together through our collaboration, through our partnership, and through our excellent network that we have, and we are very fortunate to have, to bring a smart textile to the community for prevention and for providing better care to everyone across the lifespan. I mean, here are examples of the older adults, but there's a lot of opportunities for children and youth. And we all believe that smart textiles are the pathway for a healthier world globally. Thank you.
Okay, friends, we are moving into the Q&A portion of the morning. So we'll take questions from the crowd here. I also see that there are questions streaming in from our friends online, so keep those coming. Sorry, I'm hiding in the back of the room here. So do you have any questions from the room so far? Think on that. I'll start with some questions that are coming in online. So we have a question around what is being done with wearables to make them beautiful and fashionable to wear. So the sentiment here being that colors, fashion, style are important to people with special needs as well. Not sure if anyone here wants to respond to that as a day or Helen, you've been put on the spot. Is your mic live?
I'm hoping so. Is it? Okay, great. Well, I think here at Fibre and Kite, we've kind of just started this to try to integrate textile engineers and fashion engineers and fashion designers into the process of design. So bringing design more towards the beginning of the research rather than it being such an add-on at the end, so that there's an integrated approach with design and the fashion side. Because if that's not an integrated approach, we could end up with a product at the end that's had years of research going into it and it works, but then the patient doesn't want to wear it. So adoption is a critical issue in this, and so design is a critical issue in amongst this research. I think that's my answer to that.
And I'd be remiss if I didn't flag for you, and I recognize some of you in the room that have attended some of our Kite Creates events. So this is a program you can see for folks in the room, our banner in the back, that's all about bridging and bringing communities together. So one of the communities that we've been very intentional about welcoming to Kite is the fashion and design community. Helen and team have hosted an amazing kind of 3-part series on fashion or apparel and technology, and a lot of that was meant to kind of bring folks from a mainstream design and fashion industry and promote cross-fertilization. So those are some of the small ways. Yes.
Could I suggest that we ask Dr. Raja from Sona College to say a couple of words? He's the head of fashion technology at the Sona College, and he's probably got some ideas and thoughts that may be very helpful. Dr. Raja, are you there?
Yeah.
Okay.
Yeah, Krish,
Thank you, Jim.
good evening. So can you able to hear me?
Yes, we can hear you.
Yeah. See, actually, the designing of the wearable technology is mostly focused on 2 areas. So one is the technical part where any component which conduct the textile signals, it requires the technical area, and other area which again the aesthetic part. So even we design any kind of sleeve, so that requires aesthetic part also, because we are going to use multiple times. And these 2 are most important when you are going to design any kind of product. So apparel technology mainly focus on the fit. If you are designing a shirt, especially to acquire signals from either ECG or any kind of things, the fit is very important. If it is not having a proper fit, definitely the signal acquire and noise, all other things are again important factor. So that's why the proper pattern, making of proper things, it is very important. That's why apparel technology and fashion is very crucial to make it this kind of product development.
Yeah, just to add to Dr. Raja, this is something that we were discussing just today morning, where we said that we should, the question how to make it wearable more fashionable. We were saying that instead of we should try to work with fashion and embed this thing as a part of the garment rather than it being like a outside messy fit or something. We need to be in conjuncture with fashion. So, in the sense that you should be able to remove this and then wash the garment as it is, because otherwise, if you incorporate wearable within this, then washability becomes an issue. And whereas if you are able to remove it, then you just wash it as a normal garment. So that way, for a end user, it becomes much more palatable to use. So thank you.
Shall I answer it? So there's a question about what type of research we're doing related to orthostatic intolerance when the people have a problem in, for example, controlling their blood pressure if they stand up or sitting down quickly. And that is one of the research that has been done, at least in terms of the research, for a long time in our sites at the Lyndhurst, especially, for example, for people with a spinal cord injury, and how to better monitor the blood pressure and activate the muscles to help with their control of the balance. And so some of the work that we mentioned in terms of the hemodynamic monitoring, blood pressure monitoring, and then stimulation of the muscles can be applied to that. At the moment, we are not specifically looking for textile to do that, but it is quite feasible with the technologies that we have to look into that. Thank you very much, Liz.
I'm still scanning the room for questions. If I don't see hands, I'll jump to another online one. So our next question is, what measures are being considered for people with sensory issues? A lot of children and adults with autism struggle with clothes due to sensory issues. What design strategies are being implemented to address these? Anyone have a comment on that? And yes, I welcome our friends from the SONA group as well online. But I don't see a visual of you, so I cannot see if anyone is from our friends at SONA might be raising a hand. I think there's a reply coming.
That's excuse me. Yes. See,
Yes, please go ahead.
sensory issues.
So I think we're just having an audio issue at the moment.
Able to hear me?
Yes. Do you have another mic? Perhaps you could try.
Yes, hello, am I audible now?
Oh, that was better. That was better.
See, who it may be the person. Who it may be the person, those who have sensory issues. See, usually everybody we are wearing clothes, dresses. So in such circumstance, what we are planning is we are planning to use the cloth itself acting as a sensors as well as stimulators. So that we understand that the persons who have ADHD or autism or whatever it may be the problems, they are also wearing, clothes. So we are changing or modifying the, dresses to acquire the biological signal, as well as the dresses to deliver the stimulus and signals to the body. So that I think this we are progressing through our researchers, which will be more benefited. That is what my insight on this particular question. In one of the
Thank
things
you.
that
Yes, we had a little bit of issues with the audio, but I think we made out some of that. Thank you for the reply.
they're starting to Dr. Prabhakar, one of the things that has come out of light, especially with autism, with respect to India, from an Indian context, is that the pollution is adding a lot to autism today, and they are linking it back to pregnancy. They're saying that, during because of the pollution, the quality of air that is being supplied within the womb and things like that is affecting the newborn baby. So perhaps we should be looking at something combined to see how we can solve those kind of issues. And then because pollution is correlation between pollution and autism is coming out to be in a high degree. So yeah, happy to collaborate on any of this on this subject. Thank you.
Thank you for that perspective. Was there something you wanted to add, Asid?
So that's a great question. And then also the comment from Choco was excellent in terms of the association between pollution as a prevention, and then how we can also look into whether our clothing can be a way of knowing if there is exposure to pollution in the environment. For example, for pregnant moms, that could impact either the health of the baby, the fetus, or the other people that might be at higher risk of the allergies. In terms of the design, I think one of the strengths that we have at in our interdisciplinary partnership, and then the strengths of the textile engineering that we have with Sona Group, and then also here, is we can design different textile. We are not limited to one shirt. We can, for example, think that if a child doesn't want to wear a shirt, do they like to wear socks? If it doesn't work, can we have something like pillow cover? So we can really expand the design based on what the type of the material we can put into the textile to fit the needs of different population. So really, and that's why bringing the people in the room from day one of how to design is a strength that we have within the Fibre and our collaboration with Sona Group. And I always remember when I talk about socks and how exciting they are, there are people that don't like to wear socks, especially in India.
So I have a question, is that a lot of technologies and wearables are based off of data-driven and AI. How are you actually balancing the trust of patient and the privacies?
Patient and privacy.
I think Professor Satyabama has some.
So just the announcement.
Sorry, I think there's an issue with that particular mic. I think the one that. Yes. Yeah, the far side one I think was working a little better.
Yeah, we're trying to get one more. So 1 second. Yeah, yes, we can hear you. 1 second, we're trying another mic.
Yeah.
Okay, that's good. That's great. Thank you.
I'm thinking. Can you hear us, Kelly?
I'm sorry. I think it's that particular mic there. So one of the handheld ones seem to be working better.
Yeah, 1 second. She's coming to address you. 1 second.
Hey, my apologies. While we do that, I just want to make a quick. I'm noticing our chat. I think I inadvertently used an appropriate term prior to describe the disabled community to the questioner. I don't have the details in front of me. My apologies. We will be more cautious of our language moving forward.
Yes. Yeah, it's a very good question actually.
It's still sorry, it's still a little difficult to hear you. It's quite choppy.
Sir, good evening, sir. Can you able to hear me properly?
Yes, that mic works. That is a great mic, and we want to we don't want to miss any of the great insights that I'm sure are coming. So I appreciate your patience. Yes.
Sorry, sir. Sorry for the inconvenience. So actually, it's a very good question. We should the sensitive issues. And as you said, those privacy details also will be a proper key. So that's one of the.
I apologize. I don't know if it's just our end. We're also getting some interference. If we could try maybe one more mic. Yeah, and speak maybe a little more slowly. There may be a lag. Oh, and one suggestion was to move away from the other mics. It might be interference between the two mics. I do want to acknowledge that this is a transcontinental hybrid forum, so I think we're doing great as is. So thank you for all your patience.
Oh, we can surely the patient details. So we have a lot of privacy algorithms that we have worked with in our previous projects. So of course, we will be maintaining those details securely, and sensitive data will be hidden also.
Okay, thank you.
That's a great suggestion on how really, and you're very fortunate to have Sona Group in terms of the excellence AI and data processing expertise, and then how to incorporate different methods of processing that some are local, some are across devices. So we make sure that we keep the privacy of the patient data while we can also do processes. I hope
Yeah,
that was
another area, Dr. Azade, which perhaps help the team here is that we developed a lot of experience and expertise in quantum computing. So if any of your researchers require some quantum computing help, we have a team who are ready with some quantum computing experience as well. So thank you.
Oh, absolutely. Thank you so much. And now we are having more data, so we can really work on that.
Several of the projects that we are doing have an AI built into the concept. So hopefully when these products are released, you have got integrated with AI on some of them. And certainly on the next round of projects, there are a couple of projects in the third round that have AI as a core in the research. Just wanted to make sure we heard that.
Thank you very much. And we do have an excellent team when it comes into the privacy and then user-centered assessment and incorporation of data processing methods.
Okay, thank you everyone for your contributions. One last scan in the room. Mr. Angelo.
Thank you. There was a lot of conversations today with regards to collaborations between academic institutions. How does corporate innovation come into play? There's a lot of corporates that have a lot of IP. They don't know how to commercialize it. Earlier today on the slide, I saw Myant. I think they're one of those examples. There's a lot of potential for collaboration there. But what does the future of collaboration look like between the public and the private sector to solve these real world problems?
Excellent question.
I'll take a stab at it, but I'd like Choco's help to answer this because he's a leading entrepreneur. But number one is to get a product that makes sense. And when I say it makes sense, it does what it's supposed to do. The second part of it, it's got to be affordable. Thirdly, it's got to be, in the case of fiber, a textile that does all of these things, but also has the benefits of textiles, washability, durability, and so forth. So these are the kinds of things from a corporate point of view, when you ask the question, these are the kinds of questions that we ask about the product. Are they washable? Are they durable? Can they withstand? And in fact, in some of these things, we've set some parameters that say they need 60 wash cycles or 50 wash cycles, etc. But you got to bring those kinds of thoughts from the corporate side into the research. Ultimately, research is not, if it's not going to benefit humanity in some way, it's academic, right? So you got to blend the two. Choco, I wonder whether you had any other thoughts to add to this.
Yeah, definitely, Krish. So there are two spectrums, right? So you have one industry which is being the one set of industries or companies, enterprises which are doing things the way, and they continue to do those things. So for those, if you asked, for Henry Ford famously said, if I'd asked people what they want, they would have said they need a faster horse. So, so if you're trying to develop something revolutionary, then they may not understand that unless we develop that. But whereas there's another set of companies which are coming up with a lot of innovation, inventions, and like, especially the Gen Z companies which are coming out far ahead in terms of thinking on their feet and coming out with innovation. Some of those innovations are lost because there's no combined way to capture some of those innovations. So what we need is a cross section where academia and industry come together and collaborate. And I mean, I've seen a lot of areas, especially I think Canada does this very well, especially when I had seen some of the inventions and collaborations between industry and seeing some of the large industries come forward and set up the incubators in Waterloo, for example, or in other places. So I think the idea would be to encourage more conversations between companies and academia together to harness what is there in one area with the other ecosystem. So yeah, thank you.
Great. Thank you for the question. Thank you for the responses. I think this is a great way to kind of bring to close the importance of why sessions like this matter, right? Taking insights and prototypes from the lab to market is ultimately what we're all trying to accomplish. I'm getting signals from our organizers that to keep on track, we're going to unfortunately have to close this Q&A period. So as was indicated to you, I hope prior and as you were entering the room, I encourage the folks in the room just to look down at your name badges. So if you have green, that's a signal for you that you are remaining in the room for a closed session. This is in addition to this wonderful morning of conversation and discussion, this is an opportunity for our scientists on both sides to actually dig deeper. So what we've proposed is for our friends with the badges that have the red dot, we're offering a tour of our Kite labs. So if that is you, we're going to kindly invite you to grab a snack. There's still plenty of refreshments back here. Meet me outside. I'll be waiting outside of these doors, auditorium doors. And then when we convene, I'm happy to kind of show you some of the amazing work and where all the magic happens here at Kite. So with that, I will turn this back to maybe as a day to set up the rest of the morning.
So thank you so much, everyone. So we will have a short networking, and then we will continue after at 10 o'clock.
Thank you.